Could you please give us a brief introduction about yourself, Uncle?
My name is Femi Abdul. I'm from Nigeria. I'm a businessman. And this is my wife, Miss Bilkisu Abdul. She's a civil servant. And we all come from Nigeria. And I like go ahead about my sickness.
Yeah, how you found it? Do you know right now what kind of disease are you suffering?
Yeah, I was diagnosed.
Yes, he was no exact. I mean, actually, he never knew he had the disease. He didn't know. Not until when he ran into coma, when he was very sick. So we took him to the hospital, specialist hospital, Gwagwalada in Abuja, Nigeria. So it was there that doctors, after some tests, they ran on him. They found out that he's having a kidney problem. So they were treating him and giving him dialysis. So it seems the treatment they are giving is not improving the situation. So the doctor, consultant there, Dr. Manven, now suggests transplant. That is better he goes for transplant. And when we agree with her, we are asked, which country do you want to go? And do we have donors? Actually, we have 2 donors from the family. But we thought that it's not fair for us to collect a small child coming, a small grown-up boy coming. Since he is going older, that it's better we find another solution. That's notwithstanding, the family was still trying to go for this transplant. If not because of the crisis in Egypt, we were to go to Egypt, and we could have gone. Not until when Aisha, our daughter, brought the information about this hospital situation.
Oh, you mean you heard somebody who has received the treatment in a hospital before, and then they recommend you to come to a hospital?
No, yes. That's Aisha, our daughter, who gave us the information concerning this hospital. So we now saw it wise. I thought it wise. It's better we come for treatment instead of transplant. We never knew about anything concerning transplant. If not that when we got here, we started hearing people who has the information concerning transplant telling us it's not a good idea. That treatment is the solution for now. So we now suggested that instead of going for transplant, why don't we go for the treatment in China? So we now told our daughter to get more information. That was when the issue of Dr. Kandi came in. That's a staff in their office, NAFDAC. The husband has this problem. They came to China and he's feeling better. So it's better we go there for our treatment. So we now told her, the family now come together and then told her to go ahead to gather all information concerning this hospital from Dr. Kandi. So everything came to pass. That's how we now came to this hospital.
So how was the treatment in this hospital? What kind of treatment did you receive during the hospitalization?
Fine.
It's like, what kind of treatment? Is that a surgery or operation or any other treatment?
No. The type of treatment we received right from the day 1 was very impressive. The way I was welcome, or we were welcome here, was very nice. It's even enough to cure the disease because all the nurses, doctors, they were out to welcome us. So we got here and the test, we started having the test immediately. From the test, we started receiving treatment. And we have been receiving comprehensive treatment since.
That is the traditional Chinese herbal medicine, right?
Yes.
The micro Chinese medicine, osmotherapy,
yes.
The medicine baths, the foot baths, those kind of acupuncture treatment have you received or not?
Yes.
Acupuncture from the acupoint.
Yes.
Yeah, those kind of treatment.
And
so after you receive the treatment here, how do you think about the curative effect?
In fact, I was surprised that within 2 weeks, I was getting better.
How are the changes there? How are the changes?
Yes, there's a lot of changes. I was relieved. All the burden I was having on me before was gone. And I felt relieved medically. And I just don't know how to express myself because I know what I went through when I was receiving treatment in another hospital in Nigeria. I know what I was going through. There was no enough good treatment, and it was getting worse and worse. My health wise was getting worse and worse. So here I was surprised that within 2 weeks I was able to stand on my feet.
Okay, because Auntie, you always accompany Uncle. So could you please tell us some basic information about Uncle's health? That is before what kind of situation he has been suffered. I mean, before he came to China, right? So after he came to China and received this specific treatment here, how his changes?
Yes. Actually, I was all along with him in Nigeria, from one hospital to the other. Actually, in Nigeria, they run some tests on him, scanning, but the treatment they gave was not impressive because it was not giving full treatment on him. It was not affecting him positively. So when we came here to China, in fact, there's an excellent treatment given to him because the issue of coughing stopped. When he wants to lie down, he cannot lie down at home. He sleeps on long chair. Even on the bed, he cannot lie down on bed. It's always uncomfortable. But when he got here, he was able to lie down on bed, sleep well, no more coughing, even the issue of weakness. He cannot even walk from here, even little distance, from here to the office there. He cannot walk. You see that he's panting, as if he has run race. So, even so many things, even to even eat, if he's eating, as if he has run a race, is terrible. The condition was not good. Not good at all. And he ran dialysis was 2 times a week. He has to, even when after the dialysis, he will be okay that time. The following day is another thing. But when he came here, I was surprised. In fact, he can walk. Even when our nurse take us out, he said, should I use wheelchair? Sit down, let us go with wheelchair. I said, no, he's okay. If you should know the type of condition he was in Nigeria, you will know that excellently he has been healed here. So the treatment people gave to us here is good because we have the China herbal medicine you gave, and together with the Western treatment you gave, the tablets you gave, they all work well. All those problems that make him weak, make him not to be a human being, because if somebody cannot walk, you cannot eat, there's nothing you can do, you're not a human being because you cannot stand. But all those ones, they are gone. So in fact, the treatment people give here is good. And I believe when others see him, he's going to be an example. And I believe people will come for their own treatment. Even those who don't have the money will go and look for. At least health is wealth. They will come.
Yeah, so during the hospitalization, right, did they take any test for Uncle to see the changes for his physical conditions such as the creatinine level, the BUN level, or the uric acid level?
Yes.
Mm-hmm.
When we are there, they did. But the irony about the whole thing is that all these tests were conducted on him, and they know it. But the treatment to give to make him come back to normal is one that is not, that is not being given. He has not received it from them. Because if he could have received it from them, it could have been a bit okay. Maybe he couldn't have come here. But the type of treatment he's supposed to give was not sufficient that can make him to go back to his feet. Actually, they know it. They saw the test and it was revealed out. But the treatment to give to support him stand is not given.
Okay, so right now I just want to ask you another question. That is, are you satisfied with the treatment here?
Yes, excellently. We are satisfied.
That's right.
Because he can walk. We have been working together. When we go, at least when we are at home, if there's occasion, we dress. We sit down, they invite us to places. We go, we dress. But since the incident, there's nothing. Just go out, wear anyhow clothes, we go out. But here, you know, because we're about to go, and people will live here, you could have seen us. When you call us for occasion, you see us with dress well and come out.
I'm even like a 20-year-old boy now.
Yes, compared to when we were there.
As if my age has come down to 20 years.
Yes, that's great. I'm happy to hear that.
Yes.
So, are you satisfied with the service or the environment here? Do you have any good advice for that?
The advice that I will have is that I will wish the hospital will continue to be like as it was before, so that let the hospital continue with these good services.
Thank you.
More gets to the elbow of this hospital. It should continue in this good spirit. And I believe, anyway, if people have a warm reception, so whoever is coming in, with the first impression you give, you make that person to feel okay. So I don't even have anything much to say. Now to say continue in this spirit. People coming, we love to come more again.
Okay, that's good. Thank you so much. So anyhow, on behalf of all staff of the international department, we sincerely hope Uncle will get well soon. And then please,
I'm already well.
yes, and then please keep updating some basic information even after you discharge from a hospital, right? So just keep in touch, and then we are waiting for Uncle's good news soon.
Yes, we will continue to follow your instruction, the rules and regulation of health that you gave to, or you are going to give to us. We follow it strictly, and whatever problem we have, we let people know, at least to help us, because we have to help ourselves this time around, at least to follow your rules and regulation. Don't eat too much food, reduce water, not steam.
Okay, that's all. Thank you so much.
Thank you very much. Thank you.
We are family.
好，行，挺好。
Okay, because this is the patient from Libya. This is the patient from Libya, and in that side the patient from Canada. She just we are coming. This way, please, Uncle. Okay. Okay, let me introduce. This is International Department, Building B. Okay. And then this is Building C, that is for Chinese patient here. And then this is Building D. It's also for internal patient, Chinese patient here. And then you see this building. This building is Building 9 for the meeting. And this way, please. You see, these are the Chinese patient here. And then you can have a look. don't have a car. I have bicycle. Later I show you. 不是骑着电车过来。
电动车，有没有看过电动车？我的车比较大一点。
Yeah, the bicycle is good for the health. Right? 东西是没跟人说。This way, please. 你好。
你还太厉害了。不然能让我们看一下？
可以，
那我们就。
好。
方便吗？
方便在哪开呢？
就是给他就是解释一下我们的机器。哎呀，Today you are visitor, you are not patient. This is after you get fully recovered, then you come back to our hospital. 让他过去。We have different types of dialysis machine. First of all, I'm going to explain to you. This is the 这个是血液透析机是吧？
这个是传毛血粒。
传毛血粒啊。
嗯。
So this is the hemoperfusion. You know, uncle, because in Nigeria maybe they only have the hemodialysis. Perfusion, sometimes we are using a filtration treatment because that one can help you to eliminate the moderate and the macromolecular from your body. But after we use different types of dialysis machine, it provides a very favorable environment for your body. Filtration. In Nigeria, you only have hemodialysis, but this is the hemofiltration. So he feels stronger and energy. Otherwise, you see if there are high level of toxins. Yeah, but we are going to that area, Auntie. That is the plasma exchange. In our body, we have plasma, all right? So because for some of the patient, they need to get the new plasma, and at the same time, the bad plasma will be released. This is the plasma exchange treatment. That is also not available in Nigeria. That is another treatment.
呼吸机可以这么玩，呼吸机就病房呢，可以这样一块。这边有病号了那边。
Yeah, that is the new model one. That is the hemodialysis machine. Yeah. But this is the new model one, right? It types of dialysis machine here, right? Okay. Because as I told you before, our hospital is a specialized hospital in treating kidney disease and diabetes, right? That's why we are introduced a lot of dialysis machines and the function of the dialysis. That's why in the dialysis room you didn't see a lot of people here and not feel crowded. You see, every day we make the full preparation. That's why you see the machine here. Yes.
大家都可以变的。
Okay.
那去那个草绿草。
Oh, yeah, this way, please. Oh, this way, please, uncle. 然后照了好多相片，然后欧兜他们在那边，他这边我再给他从那个旗子底下给他照了一张相片。
这个地儿。
The environment here.
其实这个石头呢是用来关掉压力在上面。
You know this is. 哎呀。
这都是药。
Okay, this way, please.
Everything meeting.
This is building a.
就是你可以把上架放到导游台那儿了。
对，就不用打。You look here, and then you know sometimes I said we need to get appointment with the expert because they are here. Sometimes the Chinese patient they will come here, and then let them to help them. But sometimes after we make that is the Chinese New Year, right? So we are sitting there. We look at the program. They are dancing and they are singing. Yeah, this is the place we worked in. Yeah. You can have a look. This is the machine here.
这个机器投资了好几千万。
Yeah, that's machine, uncle. You see that big machine? It's too much expensive. It's more than 1,000 million. 1,000 million. 这是100个，我不知道的事情。这3000万我知道。Yeah, that is the ambulance. The ambulance. 应该是。Do you write cat or not? We do, but I don't like it. You don't like it? My mom, she also don't like it. 我妈猫狗都不喜欢，花儿人养了俩，我只。
这什么东西啊？人家水果啊
bird
啊，对 bird，actually bird，actually
bird flower bird director 一样的 bird。
bird， 好，什么 bird？
你太坏了，你把人都吓跑了。哎，上面有桃子吗？
难道别人都摘完了
Do you have this kind of pumpkin in Nigeria? You have or not, uncle? No. Pumpkin. 瓜。
哎，那吊着一个圆。
Peter cucumber 苦瓜。
让他给他炒了一次，一吃2口扔了。
苦瓜是这么长出来的啊？